Zika cases in India reveal gaping holes in our healthcare system. How poor was India's disease surveillance in case of Zika? What are the concerns associated with the failure of states' proper disease surveillance? How should our government react in such conditions to avoid catastrophic impact on the country's economy? Give a brief note on Zika. GS Paper 2, Issues related to health, education and human resources. What is the context about? A press release by World Health Organization says that the Zika virus was present in India in November 2016. Last year some patients tested positive for chikungunya virus and dengue virus, but many of the cases were neither. This did not raise concern as undifferentiated fever is a seasonal event and nothing new and can be due to various factors. It was underrated fact that Indians travel extensively and could import the disease easily. Mistakes apart, the real concern here is that though the presence of the virus was first confirmed by NIV, Pune in January 2017, we got to know about it in May. How poor was India's disease surveillance in case of Zika? The data regarding disease prevention is so poor in the country and there is lack of information about the Zika virus. No special care is taken for pregnant women. No reports were prepared in order to check if there were additional cases in the area. No epidemiological protocols were available to support laboratory surveillance. The government has kept the news a secret because the state was hosting a major international business summit in January to woo investments. What are the concerns associated with the failure of states' proper disease surveillance? Data collection uses taxpayers' money, and when the data is not used for improving people's health, this is a waste of public funds. Incomplete or poorly collected data is even more damaging as it can give wrong information for health planning activities. The municipal authorities in Ahmedabad were unaware of the activities of Zika virus. This fact itself smacks of either a very poor understanding of disease control principles, or, more likely, an uncoordinated, understaffed and dysfunctional system. It is not easy to track a virus in a billion-plus population, but not acting after obtaining information is a criminal waste of resources. How should our government react in such conditions to avoid catastrophic impact on the country's economy? A review of disease surveillance systems is required, not only to make this entire system relevant, but also to appreciate the hard work of data collection which is done by lower-level functionaries. The goal is not to haphazardly collect data, but to use this data for protecting the health of the population. Government stewardship of this whole system is essential, to listen, regulate and bring about a cohesive health service that can provide care to the people. India has enough technical resources and expertise. The critical role of the government in demonstrating leadership and guiding disharmonious participants is essential. Give a brief note on Zika. Zika is a disease caused by Zika virus and is spread to people through the bite of an infected Aedes species mosquito. Symptoms are very similar to viral illnesses including fever, joint pains, rash and conjunctival suffusion. The symptoms can be present roughly about a week post being bitten by an infected mosquito. However, since there is no treatment for Zika, it is important that one takes all the necessary precaution to stay safe. Efforts to control the spread of the virus include eliminating mosquito breeding sites and taking precautions against mosquito bites such as using insect repellent and mosquito nets.